everybody. We are back with Dr. G, Texas Family Wellness Clinic, and today we're talking about a very important topic. I think the majority of people here in South Texas, or at least a very big portion, suffer from diabetes or maybe pre-diabetic. It's in our genes. I know they're in mine. So, Dr. G, tell us a little bit about diabetes, pre-diabetes, and what we need to know about it.
Right. I think the big things are understanding signs and symptoms of diabetes. Mm-hmm. So some of the things that we commonly see in clinic are folks who come in with symptoms of excessive urination or frequent urination, maybe some numbness or tingling in their toes or feet, maybe problems with their vision. Maybe they've checked their blood sugar at home using their mom's, glucometer at home and found out that their blood sugar was significantly elevated. Mm-hmm. So, we have them come in and, we start an appropriate workup, which would include looking at some blood tests. So some blood tests will give us an idea about where they fall on that scale for blood sugar and prediabetes or diabetes. So you want to be asking your physician for a hemoglobin A1C blood test, possibly, of course, a fasting blood sugar, also other tests that can be considered would include insulin levels and C-peptide levels. Okay. So once we have those tests, that'll give us a really good marker of where they are and how we can approach treatment. Very,
very cool. And if you type these symptoms into WebMD, you're going to get a whole different diagnosis, which is why it's so important to visit your doctor and get these tests done. It's better to know sooner than later. Now, for pre-diabetes or somebody who already has it, are there any things we can do to reverse it, to better our situation?
Absolutely. So first and foremost, diet. We've got to, reduce carbohydrates, sugars, starches. That is a must. Exercise can be beneficial. There are some nutritional supplements that can help with blood sugar management. And then, of course, there are medications, which, we try to avoid to the best of our ability, but sometimes are necessary. So the main thing is diet. I can't stress that enough.
Exactly. And that's something that a lot of us don't want to hear because we like our fast food, we love our pasta, we love our tortillas, but it's not about completely eliminating them or just making your dietary lifestyle just, unenjoyable, but it's just little changes. In fact, recently, knowing I have diabetes in my family, I have reduced my carbohydrates, but not completely removed them. And just little changes like that can make a huge difference, right?
Absolutely. I don't advise cutting out carbohydrates entirely. First visit, we talk about reducing those things over time, maybe cutting out things like sodas, for the first month, maybe the second month you cut back on tortillas, maybe the third month you cut back on, other things like chips or whatever you may consume regularly. So it's not something that you want to stop immediately. I think that's a very hard thing to do. Yes. So kind of gradually working your way into that process, I think, is helpful. Same thing with exercise. You don't want to go and, start with, you don't want to start, an hour's worth of exercise daily. You want to work your way up to, a reasonable degree of exercise.
I love that. Again, every time I love the advice that you get. I love your approach, and I'm sure everyone at home is impressed, although some of us are like, I need my tortillas. But that's why you got to visit with your doctor. So tell us how we can get a hold of you.
TexasFamilyWellnessClinic.com is where you can go to apply to be a patient. Also check out our Facebook page at Texas Family Wellness Clinic.
Very, very good. And of course, this isn't a personal diagnosis for you. You always want to visit your doctor and get these tests done to find out what exactly is going on with you. Dr. G is your guy. Tell him Coastal Living sent you.
Health and Wellness with Dr. Guevara is paid for by Texas Family Wellness Clinic.